Thank you, Vice Chairman Gomez. Ranking Member Heiss, I want to thank all the workers on the front lines, particularly our healthcare workers. As an ER physician, my heart is with you and your family. I know this is a very trying time, but at least for the medical personnel, I know the challenge. And while it's what we signed up for, that doesn't lessen the challenge. Ms. Pico, I want to thank you for being here today and extend my deepest sympathies for your loss. And of course, we are wishing our Madam Chair a return to great health as soon as possible. I'd like to thank our nurse witness who today confirmed the recent article in the New England Journal of Medicine which said surgical masks provide limited to no additional protection in the non-healthcare setting. And in consideration of this and the fact that the Senate's been working for weeks with not a single infection, we can go back to work here in person. We know that our work will be better. The product we provide the country will be better. I want to begin by saying it is disingenuous to say that you're for workers and then not reopen the economy or drag your feet in reopening. I wish my colleagues across the aisle would see as essential the workers of this country whose taxes will pay for the $4 to $8 trillion this is going to cost us. We need to be working. The headline in the Wall Street Journal yesterday was, and I quote, "Coronavirus obliterated best African-American job market on record," end quote. Reopening the economy is the single best thing we can do to improve outcomes for all Americans, including and especially minorities. We just had a coronavirus select subcommittee hearing last week on COVID-19 racial disparities. As a physician, I mentioned many reasons why Black Americans have been especially hit hard. But Black unemployment has risen particularly because of the government-imposed shutdown, and those jobs will be harder and harder to regain the longer the shutdown lasts. Many states have successfully begun to reopen. In my home state of Tennessee, many restaurants, retail stores, gyms have all been open under social distancing guidelines for weeks now. In fact, today I flew through Charlotte, North Carolina's airport. The place was packed, shoulder to shoulder in places, and all was well. Americans are ready to go. Last week I visited Gutterbound Distillery, a family-run small business in Hurricane Mills, Tennessee that just recently resumed normal operations. But they didn't exactly sit the pandemic out. They altered normal operations to make hand sanitizer free of charge for their neighbors and first responders. To defeat this virus, we have to let them reopen and lead the way toward recovery across the nation. There are many things this committee can do right now to help reverse the damage caused by the shutdown, and here are 3 suggestions. First, we should permanently repeal the roughly 400 regulations that have been suspended during the crisis. I co-sponsored Congressman Roy's Coronavirus Regulatory Repeal Act that would do just that. If these regulations weren't needed during the crisis, then why do we need them at all? We must give our nation's businesses the freedom and flexibility they need to bounce back. Second, we should examine the federal government's many outdated and bureaucratic healthcare laws and rules. As all of my colleagues here know, our rural hospitals are struggling, and this pandemic has only exacerbated their challenge. Last week, I visited a hospital in Waverly to discuss these challenges. If we don't cut the red tape and let these hospitals serve their communities, we will see dire long-term consequences. Certificates of need should not impose revenue stream limitations on critical access hospitals. And finally, we must confront Beijing and hold them accountable for the spread of the virus in the first place. The Chinese Communist Party hid the severity of the coronavirus, crushed whistleblowers, denied offers of U.S. aid, allowed the coronavirus to spread, and covertly hoarded PPE. The leadership of China is taking China from a friend of America to an adversary of America, and we need to hold the CCP accountable. For starters, the House should vote on my bill, House Resolution 6903, the Bring American Companies Home Act. This bill incentivizes American companies to move back and covers 100% of their moving costs. In medicine, we have a rule, first do no harm. Keeping the economy closed continues to harm millions of Americans. It's time to not just reopen the economy, but to take proactive steps to reverse the damage. This is where our Oversight Committee can lead, and I ask Madam Chair and all the members, let's lead on that. Let's get Americans back to work, open up our businesses, and save jobs and lives. Thank you. I yield back.